This is Digital Poster 2803, Magic Angle Directional Imaging MADI Standard Deviation Maps Correlate with Knee Pathology in a Spontaneous Injury Model, and presenting is Karen Chappell. I have no financial interests or relationships to disclose. Introduction. In unhealthy tissue or when the collagen structure is disrupted, the magic angle effect may disappear. Torn ligaments and degeneration may disrupt the contrast mechanism, decreasing tissue anisotropy. Our evidence for this, however, comes from non-physiological models which mimic the effect of degeneration, aging, and injury on postmortem tendon. The research question for this study was, does the magic angle effect disappear in spontaneously ruptured ligaments in dogs? At the bottom of the slide, you can see photographs of 4 dog breeds that are more prone to suffering with ACL ruptures, osteoarthritis, and meniscal injuries. Method. Ethical approval was granted to include in the study larger dog breeds euthanized at the vet hospital, where owners had given permission for a post-mortem examination. The knees were scanned on a 3 Tesla MRI scanner in the head coil using a 3D T1 flash sequence at 9 orientations to the magnetic field. Volumes were registered and aligned before standard deviation maps were computed to identify collagen-containing voxels. An interactive display was used to measure the standard deviation range of voxels and segment areas with higher standard deviations. The net collagen orientation of the voxels was displayed as fiber orientation vector maps and paraview vector glyphs. Finally, knees were dissected and photographed by the vet. Results. In a 6-month data collection period, 10 knees were scanned from 5 dogs. Breeds and demographics are shown in the table. Results. Subject 1's high standard deviation voxels were in the articular cartilage between the trochlear grooves. Subject 9 and 10's high standard deviation voxels were around the origin of the ACL. The normal standard deviation values for articular cartilage and ACL range between 0.4 and 0.6, whilst these standard deviation values were around about 0.9. This indicates that there was a very big variation in signal intensity over the corresponding voxels in these 3 subjects. The high standard deviation area in subject 1 was further explored. When the articular cartilage was segmented, the area appeared as voxel voids on both the fiber orientation map and the 3D paraview glyphs. The small 4x5 mm high standard deviation area was then segmented and visualized disorganized fibers. On dissection, this area corresponded to where the articular cartilage had been replaced by spongy fibrocartilage. The increased standard deviation voxels corresponded in both subjects to the origin of the ACL. The fiber orientation maps and paraview glyphs show net voxel collagen orientations that are highly aligned, explaining the very high standard deviation values. During dissection, subjects 9 and 10 were found to have ruptured anterior medial bands of the ACL, whilst the posterior lateral bands were intact. Discussion. The 3 subjects with high standard deviation areas had pathology, suggesting excellent correlation between MADI and dissection findings. Subject 1's fibrocartilage lesion needs further investigation to understand how the magic angle effect behaves. Fiber disorganization would reduce the magic angle effect, but the higher standard deviation values suggest the opposite. The torn anterior medial band in subject 9 and 10 have an increased magic angle effect at the ACL origin. We postulate that the highly uniform fiber alignment resulted from the force that the ligament was under when it ruptured. The fibers have become stuck in a highly aligned state rather than recoiling like elastic when the tension was removed. To conclude, we used a natural injury model to test whether the MADI technique could determine pathology with associated physiological changes. The MADI technique could distinguish healthy and injured dog knees in our blinded spontaneous injury model, providing proof of concept. The magic angle effect did not disappear in ruptured ligaments. Finally, I would like to acknowledge all these wonderful people who made the study possible. Thank you.